When we're getting our marching athletes back onto the field and we don't have equipment to challenge them, one way we can still maximize demand on their muscles and tendons is to use what's called blood flow restriction. So I'm gonna have Chase put this blood pressure cuff, this blood flow restriction cuff, around the top of his thigh. This is for lower body injury. So if we have a calf injury or a knee injury and we want to really put demand on the quadriceps muscle or the calf muscle, we're gonna restrict part of the blood flow and circulation to it with blood flow restriction. So he's gonna roll his shorts up. I'm gonna take this around his thigh, and we're gonna go pretty high because we wanna restrict the flow of blood through the femoral artery here. And then we're gonna pump it up to a percentage of what we call a limb occlusion pressure. That means how much percentage of blood flow is being restricted. So you can find his pulse down here. We can either do that in standing or sitting. You can either find the pulse manually, or you can even use what's called an ultrasound Doppler, where you can measure where the pulse is. Then you are going to shoot for a target blood flow restriction, and depending on which research you look at, you may see 40%, 60%, or 80% of that limb occlusion pressure. When you're exercising at all, you're doing some set of limb occlusion pressure. So we just want to find at what point we feel that we have occluded the circulation down to his pulse here. And then we're gonna do some math, take the percentage based off of that, and then let out a little air so that we hit that percentage in millimeters of mercury on our target here on the Doppler. Now from here, we are going to have him go through exercise. So we are gonna maximize recovery and regeneration of muscle, increase human growth hormone so that he can recover faster without having to throw heavy weights on him or a barbell on his back. So say he's got a knee or ankle injury, we can do squats to get his quads working with this blood flow restriction on. So we're gonna have him wide, just going through a regular squat, down and back. Good, and he's gonna do repetitions of that. And he's gonna feel fatigue faster because he's not getting the circulation like normal that he would to his leg. Then if we wanted to go into the lower leg and say we were working on the calf, he could stand holding on to something, doing calf raises, single leg calf raises. And we would again go for endurance, probably 30 reps on the first set, and then he may fatigue a little quicker, so we may decrease the repetitions on the second, third, and even fourth set. And as he keeps this on and he has that continuous pressure, he may start to feel his leg be a little bit tingly, even a little bit numb from the lack of circulation to it. It's normal to see some discoloration there, but as you've worked out with this for 5 to 10 minutes on at a time, and then you take it off, it will be like a dam that has built up pressure, and then he's gonna feel the circulation quickly increase into his leg, and it'll start to feel warm again, and that's how we are going to maximize human growth hormone and all of the blood chemistry that's gonna help his muscles recover faster.